Hi, I'm Dr. Lili, and this is my pocket pediatrician. Well, it's that time of year again. Even though I feel like it's been around 100 degrees where I live, pumpkin spice everything is popping up all over the place. I was in Costco today and they even had pumpkin pies for sale, and Christmas trees, but that's just insane. While people are debating whether they love or hate the pumpkin flavored everything, there's something much more important we should be thinking about at this time of the year. I've been in Target, Walmart, and Costco in the last 2 days, and all of them have little signs out saying, "Get your flu shot here." Half of us are wishing we could be at the pool right now and not thinking about the flu shots or the flu at all, but this is the time of year when we really need to get it to protect ourselves. Keep watching and I'll tell you why, and if you stay tuned to the end, you'll see myself and my family getting our injections.
When the doctor says my child has a condition, I'll learn more at my pocket pediatrician.
Every year, I cringe a little bit when the flu debates start up on social media. It usually starts with one person trying to sell some essential oils, saying that her thieves oil is better for your immune system than the flu shot is. Then you get some elderberry syrup with a little echinacea mixed in, and then you add a little bit of garlic and maybe a probiotic, and what you have is a sticky, stinky mess that really isn't going to help at all when you actually get the flu. I'm all about natural products. I'm all about boosting natural immunity. I breastfed all my babies. I believe in the good stewardship of antibiotics. And some of these home remedies might actually have something to them, especially the elderberry syrup, but it hasn't been very well studied yet. Ask any intensive care doctor if they're pumping elderberry syrup into their patients with multi-system organ failure's veins, and they're just going to look at you like you have two heads. The flu is a virulent, severe illness. The flu is caused by the influenza virus, which is highly infective and causes symptoms like high fevers, body aches, muscle aches, headaches, cough, congestion, sore throat, sinus pressure, vomiting, diarrhea, and more. Most people are fairly miserable for about 5 to 7 days, but some people get very sick, require hospitalization, or even die. One of the strangest stances I see on vaccines is when somebody tells me that they're pro-vaccine for everything except for the flu shot. They seem to feel like the flu is just a normal part of life and that they should just go ahead and get exposed to it and catch the illness. But when you look at the data, the flu is actually a devastating illness. Even though it's not a reportable disease, the CDC conducts surveillance and extrapolates and determines a lot of data from that information. In the last few years, and these numbers vary year to year, somewhere between 9 million and 35 million people catch the flu each year. Year to year, about 140,000 to 710,000 people are hospitalized from the flu virus. And each year, somewhere between 12,000 and 56,000 people died from the flu. That's just the United States, and that's just a single year. Last year, in the 2017-2018 flu season, 180 children died. Maybe that doesn't seem like such a large number to you, but I can tell you there's probably about 360 parents out there who would do anything they could to get those kids back. Of the 180 children who died last year, 80% were not vaccinated against the flu. Some parents intended to vaccinate them but didn't get around to it. Some of them were opposed to vaccines, and some of them weren't even thinking about the vaccine at all. When I think about those 56,000 deaths that occurred in a single year, I can't even wrap my head around it. I was thinking about it. I have about 600 friends on Facebook from different times in my life, and I was imagining what would happen if all of them just died in 1 year. And then if that happened 93 more times, that's what 56,000 deaths looks like. It seems like something you would want to make a movie about, but it's something that could happen every single year just from the flu. So what is effective in preventing the flu? The flu shot is. Every year in the United States, millions upon millions of people come down with the flu. Why? Because it's highly infective or very contagious, and most people are contagious before they actually even start developing symptoms, so it gets spread around really quickly. So who should get the flu shot? Everyone who's over 6 months who doesn't have a contraindication. Even egg allergies are not a contraindication. People who have severe egg allergies should be given the flu shot in a medical setting with monitoring. But just because you're allergic to eggs doesn't mean that you should suffer from the flu. If you live with somebody who has a real contraindication, like a newborn or somebody whose immune system is compromised, then you should get the shot so that you can protect them by creating kind of a cocoon of safety around them. So how does the flu shot work? In the simplest explanation, scientists take the strains of the flu that they think are most likely to cause an epidemic this year, they kill the viral particles, and then they inject them into you so that your body can start mounting an immune response. Your immune system starts recognizing the flu particles, begins the process of creating antibodies against them, so your immune system is ready to jump right in if you do get exposed to those flu particles later in the season. If you don't get the vaccine, then your body has to recognize the protein particles, start creating the antibodies from scratch, and this takes some time, and by that time the flu virus has had a lot of time to replicate and can create devastating effects on the body. If you really want to get into the science behind it, the CDC has some great resources. I've listed those in the reference section of my website, which is mypocketpediatrician.com. This process takes about 2 weeks for immune system to rev up. So you want to get your shot early in the season. The recommended time is usually around October because your body needs a chance to prepare before you're actually exposed to the flu. Even in early September, flu cases are popping up all over the country. You need to get a new shot every year because the flu virus mutates and changes, and your immunity also starts to wear off about 6 months after you receive the shot. So what's the real benefit in getting the flu shot? Well, the data changes year to year, but last year the flu shot was estimated to save about 5.3 million cases of the flu and about 85,000 hospitalizations. On average, getting the flu shot reduces your risk of hospitalization by about 40%. Another study came out last year that showed that the flu shot significantly reduces a child's risk of dying from the flu. There are a lot more numbers I could hurl at you here, but the CDC has them all listed on their website, which you can also access from going to mypocketpediatrician.com. So what do you do if it doesn't work? The flu shot is not perfect. Each year, the developers of the vaccine try to predict the strains that are most likely to cause an epidemic this year. The flu is divided into Influenza A and Influenza B, and each of these have multiple substrains like H1N1 or H3N2, which is the most common one last year. There are many others, and the process is pretty complicated, but the CDC does a good job of explaining it, if you want to check their website. Every year, some people get the shot and they still get the flu anyway. They may have been exposed to a strain not included within the vaccine. They might have gotten exposed to it within that 2-week time frame when their body hadn't quite built up all the antibodies yet. And some people just don't mount an immune response. However, getting the shot reduces your risk of catching the flu, and if you do get the flu, it reduces the severity and duration of your symptoms. If people get the flu shot, they are less likely to be hospitalized, require critical care, or die. So what are the side effects of the flu shot? Every time I see these debates pop up, everyone always says, I'm not getting the flu shot because it gave me the flu. That is physically impossible. As I said, the way they make the flu shot is by killing the flu first and then injecting it, so it can't infect you. They have zero ability to cause an infection. If someone thinks that they actually got the flu from the flu shot, they probably just happened to pick it up at the same time because, like we said, we're already seeing positive cases here in September. It's very possible you could actually catch the flu before you even get your shot this year. The most common side effects are muscle soreness, redness, pain, and swelling at the injection site. You're going to see my family getting our shots in a minute or two, and I have a couple of examples of those side effects to show you. Some people feel a little achy or nauseous, and these symptoms usually resolve within a day or two. Now, what about the scary side effects? There is something called Guillain-Barre syndrome. This occurs when the body's immune system starts damaging nerve cells. It can cause weakness and sometimes even paralysis. This condition happens sometimes after illnesses and sometimes it happens after vaccines. Getting the flu shot actually increases your risk of getting GBS by about 1 or 2 cases per every million doses of the flu shot that's administered. Now, if you actually get the flu, your risk of getting the GBS syndrome is actually even higher than that. So you're probably thinking to yourself right now, maybe I just won't get the shot and I won't get the flu, and that's going to keep me safe. And if you're able to hibernate until next May, I think that's a great plan. But if you plan on interacting with anybody else between now and May, you probably want to go ahead and get your shot because your risk of those scary side effects is greater if you get the flu than if you get the shot. The shot's going to reduce your risk of becoming critically ill, of being hospitalized, and of dying. You're also cocooning those people again around you who can't get the shot, so it's really a good idea to go ahead and get it. Now, what if you're scared of needles? It's funny because I hear this complaint all the time from people who are covered in tattoos. They tell me they don't want a shot or an IV or a needle. And I just look at them because they've spent hours with somebody injecting dye into their skin with a needle, but they tell me they're terrified of needles. Well, there is an alternative if you absolutely don't want the shot. For the last several years, the flu vaccination has been available as a nasal spray. It was really effective in the first few years, but something went wrong between 2013 and 2016. And in those years, the nasal mist was not effective at all. In the last 2 years, the CDC and the AAP didn't recommend any kind of nasal spray because something was wrong and it just wasn't working. But in those last 2 years, they've been working really hard and figuring it out. And this year, they think they've got it together and it's going to be a lot more effective. The CDC says you can go ahead and use the nasal spray if you want. The American Academy of Pediatrics does not recommend it at this point just because of the failures that they had in the past. So we would much rather you get a flu shot than the flu nasal spray. The only time we would actually recommend getting the nasal spray is if there's absolutely no chance you're going to get the shot because you don't want the needle. Then in that case, you might as well try the nasal spray and see if it works. But there's always the possibility that it won't and you might be left unprotected. So if possible, get the shot. If not, go ahead and try the nasal spray. Now, I would not recommend anything to my patients that I wouldn't do for myself or I wouldn't do for my kids. So here you go.
That's right.
I've got 4 kids and we kind of talked it out together before we went in for our shot.
So we're on our way to get the flu shot. Gonna make our immune system strong so that we stay healthy this winter. Sound good?
Yay, flu shot!
Here we are going to get our flu shots. Good?
I'm not going to say ow, ow. Oh, I forgot to put some shorts on.
Alright, we're going to do a squeeze and a pinch. Ready? You're going to do this.
And then we went ahead and got them. Not one of my boys shed a single tear for the flu shot.
Right.
Give me 5.
It didn't even hurt.
My oldest is 6 and the youngest is 1, so I was pretty impressed. The 1-year-old just kind of jumped off the table and hugged me right afterwards, and he was fine. Unfortunately, my daughter is a sympathetic crier, so she actually cried through all 4 shots. So the nice video I was hoping to create with this easy peasy flu shot didn't work out so well because she was kind of screaming in the background for all of it. And after a quick trip to Five Below, all was right with the world, and everybody told me they were happy that they got their flu shots, even my daughter. Now, I was planning on recording mine for you as well, but my cameraman is 6, and it didn't go very well.
So when your cameraman's 6, it doesn't always work out the way you want, but I did just get my flu shot.
But we did our best to show you what happened, and unfortunately, it just didn't work out. Obviously, I got my shot. I can't wait for it to start working because we're already being exposed to positive cases all over the country.
So we were getting ready for bed tonight and we noticed something really common that I get a lot of questions about after the flu shot, so we decided to continue our video. So on my daughter, you can tell here that there is really no reaction at all around it, right? Looks pretty good. Okay, but on my son's, take a look at this. So you can see right here,
My flu shot keeps.
his Band-Aid's here,
My Band-Aid
the injection was there, but down here below there's a red area that's just a little bit swollen. This is really normal when you get a flu shot, okay? And my other son has it too.
It's bad.
Same thing on him, just an area of redness, a little bit swelling. It's a little bit warm. Does it hurt here? Does yours hurt, buddy? What about you? Does it hurt?
A little bit.
A little bit. Yeah, but
Mom, mine hurts when I bend my arm.
Okay.
Like this. It hurts when I do that.
so it actually just means that the vaccine works. So that's pretty cool, right? It doesn't matter if you don't get it, but sometimes you do, and that's really normal. Okay?
Yeah.
So you guys still glad you got your flu shots?
Yeah.
Yeah.
There are about 168 million flu shots out there just waiting to be gotten, so go out and grab yours today. So I am gonna just go ahead and sip on my pumpkin flavored iced tea, satisfied that I've already done one of the most important things I needed to check off on our list for this fall. Now all we need to do are go apple picking, go on a hayride, maybe a corn maze and a pumpkin patch, and figure out what we're gonna be for Halloween. Hope you can do the same. This is Dr. Lili with my Pocket Pediatrician. Don't forget to hit that little red subscribe button down there. Please comment below, let me know what you think. Thanks for stopping by.
I got a flu shot. I got food shot. I got food shot. I'm glad I got my flu shot.
When the doctor says my child has a condition, I'll learn more at my Pocket Pediatrician.